So I'm Dr. Shanika Pruitt, a family nurse practitioner and co-owner of Hearts Connecting Health Consultants. And one of the things that we do is CPR for the community. And as doing CPR for the community, we had the wonderful time to be able to come here to the AKA Central Regional, and we were able to share with them about CPR. I received a call and said, hey, we have a medical brigade, but we would love for some of our members to know information to be able to help out if an emergency were to happen. So that was our reason for being able to come here today. If someone is out in the community and someone were to need help, our real objective is that they, one, call 911 and activate it, and if they're able to, push hard and fast on the chest to be able to help circulate that blood. But if you want more information, you can stop by our website. It's heartsconnectinghc.com.
And you mentioned something earlier about the song. So when we came in, you were playing that really popular Lamar song. So talk a little bit about that, about what that means. Okay.
So for people that were here when they came in, there was different genres and different generations of songs that were playing. All of those songs are between 100 and 120 beats per minute, because if you're doing hands-on CPR, sometimes you need something to help you reference just to know how fast you need to go. So we absolutely know our favorite Super Bowl song is one of those songs.
Gotcha. And so now, why is learning CPR significant? Like, do you have stats on like the percentage of times that people survive a critical incident if there's someone in the room who knows effective CPR?
So that's a very great question. How I can better state it is that if you receive CPR out in the community before you ever make it to the hospital, your chances for survival go up like threefold. And that's significant if you're the one on the receiving end of that and want to be able to live.
And you also gave demonstrations on the AED, and talk about what the AED is and where you can find it typically, and then who can use it. Do you have to be trained in using it?
So an AED is an automatic external defibrillator, and most public buildings, like we're here at the convention center, have them marked where it's marked typically with a little heart and a first aid kind of sign. And so basically if an emergency were to happen, we hope that someone would go and pick up that AED, bring it to the person that's down. The beauty about an AED is it actually will walk you through what is going on. So while the person is doing compressions, you can be able to get the AED onto them, and then if there is a shockable rhythm, it will then be able to deploy that to help their chances of survival.
And also today you had other little mini sessions after the main session ended. You were talking about some other critical health issues, so can you speak to that, particularly the Narcan station, the choking station, the heavy bleeds, the bleed stations? Yeah.
And I mean, oftentimes in urban areas, rural areas, really doesn't matter where you are. If someone were to receive an injury, we covered if it's a penetrating injury, like to the torso, how to be able to stop that bleed. But if it's to the extremity, how you can be able to create a tourniquet using something as simple as a t-shirt and a pin. We also talked about Narcan because we are in an opioid epidemic, and so Narcan is a way to be able to counteract that drug that they may be using. So we discussed how to be able to do that. And of course, choking. You could be sitting at dinner and somebody starts to choke. So we don't want choking to have to lead to CPR. So we talked about how to be able to deploy those maneuvers.
And quick point on Narcan, you can get that for free from different places?
So yes, actually, if you're here in the state of Missouri, you can just Google. There are multiple sites. I'm here in St. Louis, so I could tell you Urban League actually gives them out. It doesn't cost you anything. You just go in and say, I'd like to be able to have some Narcan. I'm a healthcare provider, but I have people in my family that carry Narcan in their car that can be able to give, and it's a nasal Narcan that they give. So if you know how to give a nasal spray, it's as simple as that.
What else do we need to know? What else do you want to add?
I would just say if you have the opportunity to either be able to learn hands-on CPR or come and get a certification like these wonderful ladies at AKA, do that. Find an instructor that you're comfortable with. to be able to make that happen. If you're watching this and you like what we do, we travel, we will come to you. You can be able to give us a call or stop by that website, heartsconnectinghc.com.
Okay. Awesome. Thank you. This was wonderful.